Good morning. Happy Friday to everyone. Thank you to Jay and Vicki for interpreting for us this morning. We'll start with the numbers as always. So the number of positive cases in Hamilton County has risen to 2,555. We last reported these numbers last week on Friday. So the difference, the delta, is 327 since last Friday. The number of hospitalizations is up to 465. The delta there is 39. And the number of deaths is up to 135. The delta there is 12. And I think, as we work through these numbers, we need to remind ourselves that these numbers are real people with families and loved ones and friends. And it's been a tremendous loss to our community. And we are not out of the woods. We are going to hear more from the health commissioner and the director of EMA today. But I do want to remind folks as we continue to open up that there is a way to do this safely. I was just talking to my sister earlier today. We all know what to do. Wash our hands, wear a mask, and practice safe distancing. We know to walk away if something does not feel or look safe to us. We know how to do this. We're going to have to do this. This is an ongoing behavior shift for all of us. So we need to get it right or we're going to see a spike. And I think there's some concern about that in every community as we start to reopen. So just a reminder that we're all in it together. Wear a mask for yourself and others. There's a right way to go through this together. And so we are hopeful that people will start or adhere to what we know are safe practices. So again, this morning we've got Greg Kesterman, the interim health commissioner for Hamilton County. He's going to be talking about these numbers. He'll also talk about the recovery numbers, and Nick Crosley. Before we get to that, I've got an announcement. Actually, I've got two announcements. One is about Great Parks. I had a meeting, virtual meeting, with Todd Palmater yesterday. He is the director of Hamilton County Great Parks. And so just a reminder that the Great Parks are open and they're free right now. So it's a great time to take advantage of that and go visit a park, whether it's a park you've been to or not. We've got so many great parks in Hamilton County. Do yourself a favor and get out there with your family. So our numbers are up for folks that are coming to our parks. In March, Great Parks trail use increased by 83% and overall visitation increased by 34%. So that's great news. Great Parks' 6 golf courses are open, including the driving ranges. They are practicing safe distancing there, especially as it relates to golf carts. So that's your warning, but feel free to go out and play golf on these courses. The campgrounds are open at Winton Woods and Miami Whitewater Forest. Great Parks' June openings will include restrooms, boathouses, softball fields, riding lessons, and adventure outpost. Online registration is available for Great Parks virtual day camps. Visit greatparks.org for more information. And lastly, check out Parks at Home. They have a blog for online programming and educational resources. So thanks to Great Parks for all that they are doing. And please take advantage of this opportunity to plug in to Great Parks. I'm told this weekend's going to be gorgeous. So no better time to get out and hit one of the parks. Secondly, I wanted to talk just quickly, well, maybe not so quickly, about testing. So Greg's going to talk a little bit about this. We always talk about opening up safely, and testing is always a piece of that, component of safe opening. And so as we've discussed before, the county has received federal funding, restricted funding, but federal funding to respond to COVID-19. And so one of the large tranches of money that we allocated out is going to testing. It's about $20 million, so it is a significant investment that the county is making in testing for this community. So I want to give just a little bit of detail. The RFP, or the request for proposals, is out on the street. as we speak, and so we'll be getting those responses in and then figuring out how to move forward. So I've got a little bit of information as it relates to testing to give folks an idea. I mean, this is a tremendous investment from the county, and I want folks to understand what we're trying to accomplish here. So significantly increasing testing capacity within the jurisdiction of Hamilton County will focus on best practices and guidance from public health. Ideally, this proposal will address testing capacity related to first responders, residents of congregate care facilities, frontline workers, the creation of quick response capacity for controlling COVID-19 outbreaks, including in employment and dense housing settings, the broader public as capacity is made available and public health guidance warrants that, testing strategies for minority and other high-risk populations in Hamilton County, regularly updated information regarding the availability of testing sites, and we're going to create a plan to conduct a scaled testing survey of Hamilton County. So as you can see, the scope is broad, but we know we need to do this, and so it is a large portion of our effort to respond safely to the impacts of COVID-19 in Hamilton County. The RFP also talks about how we are going to be doing more data collection and tracking to the benefit of the work of public health to make sure we understand what's happening in the community and we can evaluate trends and be a little more proactive about our response to who's getting sick in our community. So I am personally very excited about the idea that we are moving in this direction. So that's I'm trying to give updates as we start to move this money out into the community, try to give folks an idea of what that money is being used for. All right, so I think we are going to now go to Greg Kesterman, Hamilton County Health Commissioner, for an update. Greg's going to talk a little bit about the numbers and also talk about how it's going relative to the reopening. Thank you, Greg.
Thank you, Commissioner, and good morning. I wanted to start with a little bit of an update regarding Hamilton County cases. Commissioner Dreihaus just shared there's been 2,555 cases here in Hamilton County. Countywide, of those, 1,209 have recovered. So nearly half of those cases have recovered that we are aware of at this time. As Ohio begins to open back up and we see a lot more activity out and about at our community, we want to remember that COVID-19 is still here. It is still a concern for individuals as we are out and about doing our daily normal life. It's important that we work together in Hamilton County to protect each of us and to make sure that each other are safe when we're going out and about. Many things that we've talked about throughout this pandemic remain true and critical for stopping the spread of COVID-19. In fact, all of the reopening guidelines and principles that are shared on coronavirus.ohio.gov are based on these general principles. So you've heard me talk about this since February. It's critical to wash your hands as often as possible, before eating, before touching your face. And when you don't have access to a hand sink, hand sanitizer is a great second solution. In addition, we want people to cover their cough, and when you're in public, we want people to wear a mask. That mask is to help stop the spread of germs. It helps protect surfaces from getting germs on them, and it's to help protect your neighbors and the people that you're shopping with, as well as employees at the stores that you're visiting. And lastly, it's so important to keep sick at home. Oftentimes, we are all driven to push ourselves and to get back out into the community and to go to work tomorrow because we feel that personal need and that responsibility. But right now is the time to keep sick at home. If you wake up and you don't feel well, I'm asking that you stay home and don't bring your illness to others at work. Whether you have COVID-19 or any sickness, it's the right thing to do now. In addition, on your days off, if you're thinking about running errands or leaving your house, I know when you're heading to work, you have to take your temperature. I would ask that you take your temperature as well before heading out into the community. It's just one more step we can do to take some personal responsibility as we open things back up in Ohio. I'd like to show a slide talking a little bit about data regarding testing here in Ohio. We continue to see a significant increase in the amount of testing here in Hamilton County as well as Ohio. Commissioner Dreihaus just shared an exciting initiative where we'll start to see even greater testing here in Hamilton County and have even more data to share. But at this time, it's really just fantastic to see the increase in tests that have been performed statewide. We are now up to nearly 8,000 tests being performed daily statewide. On the left side of the graph, you can see total tests performed daily. When you look at the gray bars and the blue line, you can see statewide that we've just continued to see a significant increase in those tests. I'd like to direct everyone as well to our website. There's a slide showing how to access our website at hcph.org. We have now on the COVID-19 page a testing resource where you can find test sites that are found throughout Hamilton County. By the county as well, just because we wanted to make sure that we had the best access. We are updating it with information as often as possible as we learn new sites, as we learn new requirements. The other advantage to our website is it does include the hours of operation. It includes phone numbers for the clinics and the testing locations, and it also includes what's required. So if you're getting ready to go get a test, before you go, it'll share that you might need a doctor's prescription, or it'll share what information you might need. So please check that out. In addition, if you feel so much like you need to get a test for COVID-19, it's critical that you're not going out and about while you're waiting for that test. Begin that self-isolation to keep that sickness at home and not spread illness in our community. One more item on testing. If the Director of Health on May 27th signed a director's order that allows for increased testing within nursing homes, the state is going to begin utilizing the Ohio National Guard to test within our nursing homes. They are starting with employees in these settings to make sure that sick employees are isolated appropriately, and then systematically they'll work through to the residents within our nursing home communities. Now let's move on to complaints. Our office continues to manage the complaint portion of the stay-at-home order. We know that we continue to see approximately 15 complaints per day here in Hamilton County. The breakdown on the graph shown on the screen, this most significant number of complaints is social distancing complaints. This slide is showing based on the primary complaint. Somebody might have complained about social distancing and face masks. We clumped them together for simplicity. So the primary complaint, 129 social distancing complaints. This generally has been people upset about how tightly people are packed together in lines. In addition, we see instances where people are upset when they walk into a restaurant and see two employees standing directly next to each other not wearing the required masks. Obviously, the red, which represents 127 complaints, is pertaining to no masking. Often these complaints are when people show up at a business and individuals don't have the required masks on. More often than not, these businesses are more than welcome to comply once they understand that they are not exempt. There are instances if you're in an office environment and sitting in your own space that you might not be required to wear that mask. But when you're close to another employee, masks are always required. And then lastly, this data dates back about a month and a half through the present. We have approximately 107 non-essential complaints. These are complaints where people feel like your business was open and it was a non-essential business. I'd like to continue to take and urge people to take personal responsibility as we open up Ohio. I've already spoke about several things that we as individuals can do: keeping sick at home, washing hands, covering cough. We really need to do these things so that we can get past COVID-19 and open up safely. Use your mask when you're in businesses. And if you feel uncomfortable when you enter a business, I think the number one thing you can do is leave that business. Feel free to let the business know why, and so that those businesses can begin to make changes in their operations to make us all feel safe when we go there. With all of the guidance on reopenings, coupled with the fact that this is a once-in-a-100-year pandemic, there are bound to be loopholes, glitches, and exceptions, and one-off situations. We ask that everyone help work through these and be kind to one another as we work through this process. Call us with questions, 946-7800. Once again, 946-7800. And we are happy to talk through plans and ideas and to help get businesses back up and running safely within all the guidance documents the state has published. With that, I'll turn it back over to Commissioner Dreihaus.
Thank you, Greg. All right. Nick Crosley's here. Protecting and supporting first responders, healthcare providers, and human service workers is of the utmost importance to Hamilton County leadership, especially during COVID-19. After receiving much needed PPE, or personal protective equipment, from various sources, including the National Stockpile, the State of Ohio, Hamilton County, and items generously donated from local businesses and residents, it was evident to Hamilton County leaders that more needed to be done to secure the necessary PPE for our local heroes on the front lines of COVID-19. Nick Crosley, the director of EMA, is going to talk about how his agency has creatively responded to the challenge and how we are moving forward as a county as it relates to PPE. So, with pleasure, I will introduce Nick Crosley.
Thank you, Commissioner Dreihaus. So just to give some background, Hamilton County Emergency Management is the coordinated entity for emergency management, disasters, large-scale emergencies in Hamilton County. And from the outset of this event, we started monitoring the international situation as it moved toward the United States in February. In the middle of March, we activated our Emergency Operations Center, reached out to the relevant partners that we needed to talk about the situation with, one of them being our ESF 8, Emergency Support Function 8, Medical and Health lead, Hamilton County Public Health, and started looking at what would be needed if the global pandemic impacted Hamilton County in any significant fashion. And I'm really glad we did. And so one of the first things we were asked to do by Hamilton County Public Health was to facilitate the reception and distribution of the strategic national stockpile as it was distributed by the federal government to the states. And so we readily accepted that mission. We partnered with a local business that is donating warehouse space, generously donating warehouse space and staff to support our efforts. And from them have developed an incredible personal protective equipment as well as sanitation supply chain that is meeting currently an unmet need or unmeetable need within Hamilton County. And so, as Commissioner Dreihaus said, if we want to show the first slide, things that we're distributing at this point include N95 mask, KN95 mask, all different types of surgical mask, cloth mask, as well as respirators to our local fire departments. We've distributed, and I'll get into some numbers here in a minute, gloves and gowns, so medical grade and non-medical grade, eye protection, both face shields and goggles. And then as we started talking to not only our first responders, but also there's hundreds of community support agencies and nonprofits in Hamilton County, we started hearing a need for disinfectant material. So as we can all remember, in March and early April, it was very difficult to get disinfectant, wipes, sprays, that kind of thing, especially to the level that many of our congregate care facilities need. So our nursing homes, our group homes, any kind of congregate living facility. And then also, as we all know, hand sanitizers and thermometers became very, very difficult to procure. And so I approached the county and I just sort of asked the question, or laid out the need to Commissioner Dreihaus and the board and to Administrator Ludo, and just explained that there is the distribution coming from the state that we're sending out to the hospitals, and I'll talk about here in a second, our priority levels. But we're also seeing this other need for the vast majority of the vulnerable populations that we have in Hamilton County. And so I asked permission and received permission to start advancing into some of these other needs that were needed. And so Just to go back to our highest priorities on the next slide. So we start out, especially with the state distributions and the federal distributions, our number one priority, especially for N95 masks and gowns and gloves and things like that from the state and federal stockpile, are hospitals. So again, many of you remember we had a huge deficit, if you will, for N95 masks and gowns. We still experience that deficit. However, we are starting to see some more of those delivered, and you'll see our numbers here in a second. We also worked extensively with every single fire department in the county, as well as EMS provider, law enforcement. We've worked extensively with almost 100 congregate care facilities, many of them nursing homes, again, some of our most vulnerable populations. And then, of course, we worked extensively with the Hamilton County Jail. A very successful mitigation effort was engaged in at the jail. I do believe they didn't have a single inmate infected with COVID, and just a few staff members, which was quite a success story. And we worked closely with them to make sure they had the protection that they need, that we could provide. And then we worked with law enforcement agencies, either individually or through their local fire department. So those are sort of our highest priorities. Other organizations, as I've stated, we've worked with a lot of frontline community organizations, local governments, home health care, mental health services, public health agencies, and then any industry deemed critical by the federal government, federal or state government, if they needed assistance. Because as the pandemic spread out and as we went into these stay-at-home orders, as some of these businesses that were critical needed assistance, we were able to provide a little bit of assistance to them. So as we stated, the Strategic National Stockpile was basically our first provider of PPE. Then we started getting into the ODH, our Ohio Department of Health, and the Ohio Emergency Management Agency was able to send us some supplies as well, and we distributed those based on a formula worked out with the public health agencies. Then we put out the call for Hamilton County residents and businesses to donate personal protective equipment, and that was really successful beyond what I had imagined. And that saved a lot of energy, it saved a lot of time, and it saved a lot of lives to be able to distribute, to take that PPE, everything from the 3 N95 masks we'd get from one person to a company donating 3,000. I'll never forget a donation from Habitat for Humanity, who knew they wouldn't be building for a while, and they donated 3,000 N95s that we were able to distribute to nursing homes and other relevant providers. And so very successful. And then I want to talk about clearly, obviously, working with Hamilton County government on both before and after we had CARES Act funding, and going to them with our request to expand our operation to a lot more community support organizations. To date, we did some tallying the other day, and Hamilton County has committed almost $1.8 million to the effort to procure PPE and other sanitizing and disinfecting supplies. And we've been really fortunate here in Hamilton County for them to step up and hand those out. If you go to the next slide. So this is sort of a breakdown of how many orders we filled. So again, we're a small agency. We're 8 staff. We probably donated half of our staff to this effort since it started. In 2 months, so just in 2 months' time, we stood up and continued to operate a reception and distribution warehouse to support our community organizations and local governments and healthcare community. We've helped over 340 individual entities. So again, that's anywhere from a home health care agency to a nursing home to a hospital to a public safety agency. And you can see the breakdown there where we've pretty much gone the gamut. So you see 27 jurisdictions, that's 27 direct outlays, but of course we've worked with every single fire department, which in our case a lot of times is the primary reception spot for many of these communities. Lots of healthcare providers, so as the healthcare environment reopened, we'd had a lot of healthcare providers donate to us. We took that into consideration, and then we also took into consideration that reopening the healthcare community is a must if we're going to get back to a normalized society and normalized environment. And so we definitely helped, almost 177 organizations reopen with a small amount of personal protective equipment. And then, of course, the 75 long-term care and specialty health care providers. So we helped everybody from eye doctors to ortho clinics, the whole bit, and then 33 other organizations. So we've got this all broken down. But I just wanted to sort of give that outlay that this has been quite the effort in 60 days. So in 60 days, we're filling an average of 80 to 100 orders a week. Our process is that the agency or organization needing assistance calls us. So again, we do focus on nonprofits, governmental, some for-profit, depending on their mission. As we said, we've helped healthcare clinics. But we have them call us so we can sort of walk through their need, because you'll see here in a second, I'm going to show you some statistics here in a minute, or some numbers, where obviously, or in my view, even today, so up till this week, the need continues to outstrip the availability of personal protective equipment and sort of medical grade disinfectant. And so we've continued our efforts. So I check in regularly with the Board of County Commissioners as well as county administration on our process and policy as we move forward. And so our process is we have organizations call us, and then we have our staff just have a conversation with them about what type of work are you doing, what's the best personal protective equipment that we can share with you, and then we try to meet that need as best we can, or put them in touch with somebody that might be able to help them. So next slide. So as you can see, since the time that we started, again, 2 months ago, we've done a lot. So if you look at just N95 ask alone, so the ask is almost 30 to 50% more than we've been able to distribute. So we still struggle with being able to buy N95s. We can buy KN95s, which is just the slight step down. We share a lot of those with nursing homes and other congregate facilities that provide a little bit more protection than a normal surgical mask. But you can see in 2 months we've distributed over 180,000 N95 masks, and that's up 50,000 just from statistics I gave you a week ago. So that need continues to be there, and that distribution effort continues. Surgical mask, almost over 460,000 medical grade surgical mask. So that is quite an effort. 3-ply mask, cloth mask. We just recently received our first distribution of cloth mask. And I believe our number now committed is over 32,000 of those 51,000 we've received. And then we'll be purchasing and distributing more cloth masks after this. And then as you can see, we've had requests for over 2.3 million medical grade gloves, and we've distributed almost 800,000 medical grade gloves. And then of course gowns, which has been one of our biggest challenges, medical grade gowns. We've received over 160,000 requests for those numbers total, and we've distributed almost 45,000 gowns to our local organizations. So quite the effort on the part of my staff who have been working out there. And then sort of the non-traditional PPE that, again, recognizing a need in the community, I went out and talked to the board and talked to county administration. If you want to go to the next slide. We started, again, seeing that need for eye protection, for hand sanitizer, for disinfectant kits. One of the groups we worked closely with, 3 of them that we work closely with, are the Council on Aging, Developmental Disability Supports, and the Mental Health Board, because they don't necessarily employ all of these organizations, but they have quite a network of providers. And so we wanted to make sure that we protected not only the staff who are working out in the community and continue to work out throughout this event with their clients and with their people that they take care of, we wanted to make sure that their clients are taken care of as well. And so we worked with them extensively to put together, for example, it started with the seniors putting together disinfectant kits because we found a need where, and I found this, and I'm obviously fully able-bodied, trying to get to the store in time to get that last batch of disinfectant wipes, our toilet paper, our paper towels. And so we're not doing the toilet paper and paper towels as much anymore, but there was a time there when you couldn't get these kind of supplies. And again, sticking to our mission, and I call it a classically trained social worker, having gone to school for that, approaching and realizing a need and just asking the commissioners to consider it, and we did, because it was considered personal protective equipment. It was needed by vulnerable members of our community. And we continue to distribute hand sanitizer. We buy it in bulk and we distribute it to organizations in need. Eye protection, disinfectant wipes. So we're, especially for congregate care facilities, nursing homes, group homes, things like that. Medical grade disinfectant wipes and medical grade disinfectant, as well as thermometers. We actually just got an order of thermometers in the other day, and we distribute those carefully. And then we bought a large stash of thermometer stickers that you can put on your forehead. And I can tell you the reception of the community has just been outstanding, and we've been we felt very fortunate. My staff has felt fortunate to be able to fulfill this mission. We continue to work closely with all of our communities and continue our personal protective equipment mission. We have no end date in mind. So we think that in planning with our public health partners, looking at both just the current state of trying to treat COVID-19 as well as looking at when we might have a vaccine, we feel like we'll be working and coordinating with the state and federal government on the distribution, acquisition and distribution of personal protective equipment for a long time coming. And then I just wanted to sort of bring this all to a close with just some final thoughts. We are continuing reviewing what our role is in all this. As things open up in the economy, I'm sure companies and organizations will get back to purchasing, but there will be a need as long as we're in this event. And again, I think our overarching goal is to work with our community to protect our most vulnerable citizens, both young and old, in any kind of economic situation. We continue to document the resource needs, so we continue to have conversations with the county who funds this operation. We continue to clarify our distribution priorities with our partners so that everybody understands what we can and can't do. So for the most part, people may call with an X request and we ended up giving them Y, just because that's what we have on hand. But we've found great support from our community members. And then, of course, we continue to coordinate as an agency, working with our communities, all 49 communities in the county, long-term community support planning for sustained support and recovery of the COVID-19 event. In addition to our monitoring and responding to severe weather events, as we've had several this year so far. So that's really my update, Commissioner. It's been an honor to serve the community during this unique disaster. I've been in emergency management for 22 years. I've thought about, planned for, considered a pandemic. This is my first pandemic. This is all of our first pandemic in most of our lifetimes. I hope it's the last. But if not, we've learned a lot, and then we've been honored to be able to engage in this mission, working with Greg Kesterman over at Hamilton County Public Health and Cincinnati Public Health, Norwood, and Springdale, and then, of course, all of our other community partners. Thank you.
Thanks, Nick. As you can see, I was asked the other day, we're in the middle of a pandemic. What have we learned so far? And it's what you said, that we have been coordinating with other agencies and other communities in a way that I think is unprecedented. We're on these calls with all 49 jurisdictions on a regular basis to make sure that we are listening to what's happening in the community and also responding to the needs, particularly related to PPE, because many of them have first responders, fire departments, police departments in their communities, and those individuals need PPE. And so I too am proud of the effort of Hamilton County, primarily through EMA, to try to respond and address a need that we know is ongoing in a community. And the other piece of this is that we don't want to be flat-footed in the future, and so it was tough to get some of this PPE in the beginning. I remember some not panicked calls, but close to that, saying, hey, where can we get masks? Where can we get gloves? And so we will be stockpiling ourselves to make sure that we are not flat-footed as we continue to move through this. If we were to see a spike in the future, either near or far future, we will be well prepared to respond to that as EMA. So thanks for all your work. That goes for public health too. I mean, we've learned a lot in the public health realm as well, and we need to beef up that structure, and so that's what we intend to do. So with that, Bridget, we are ready for questions. I say that collectively. Greg is already on his feet, ready for questions.
Thanks, Commissioner. The first questions are for you from Jay Hanselman with WVXC.
Drat. Okay. Hey, Jay.
Sorry to disappoint. Good morning. Couple of quick things. Cincinnati City Manager Patrick Duhaney sent a letter yesterday to County Administrator Aludo requesting some financial help. In one sentence, therefore, I am hereby requesting $15 million in coronavirus relief fund monies received or to be received by the Hamilton County under the CARES Act. You had announced a plan for those federal dollars. What do you make of the city's request, and is it possible for it to be fulfilled with the plans that you previously outlined?
So the answer is that we are prepared to help. Here's what's happening. You know what I'm going to do for next Wednesday is provide an outline of the CARES Act money and what that money has been designated for. So testing, PPE, the small business assistance program. We've got tenant relief coming. But one of the pots of money has been set aside so that we can help all 49 communities in Hamilton County try to deal with the impact that COVID-19 has had on their budgets and their operations. And so the city of Cincinnati is obviously the largest of all those jurisdictions, and we are preparing to help there, and we've set aside dollars to do that. The one caveat is that, as you know, those CARES dollars went directly to Hamilton County because of our size, uniquely. There are only 5 jurisdictions in the entire state that got those direct dollars. But the state of Ohio also got a huge relief package, and those dollars are anticipated to flow down in part to the local communities. And we've been asked this question on these jurisdiction calls that I've referred to. The question is, when will the county be providing some of that relief? What we're trying to do is wait until the state dollars come down. They're all restricted, remember. They're all these federal dollars. But the state dollars can be the first dollar in. Every community is going to get a distribution. We were hoping that that bill was going to pass this week. It did not. And so now I am hopeful that it will pass next week. I think the delay has been challenging for local communities and for us because we are poised, but we want those dollars to come down. And if the community says, all right, well, our CARES Act funding from the state fulfilled the need, remember it has to be related to their COVID-19 impact, then they're good to go. If there's a gap, that's where the county steps in and says, we still have a gap in some of these communities. The city of Cincinnati will likely be one. And what is the gap and how can we help there? So that's been kind of the tug and pull from my perspective on getting those dollars out the door, because unlike some of the smaller communities, all of the smaller communities, the county has the capacity to set up programs for small business owners, for tenants who are in trouble, for perhaps nonprofits if the guidance allows for it. For some of these, to buy people, we're the ones distributing PPE. So we are uniquely positioned to leverage our dollars to help the entire community all at once. These other communities don't have the capacity to do that. So that's the reason we're waiting for the state dollars to come down first. I hope it's next week, and then we will evaluate that and move forward with our dollars. So that's a long answer. The quick response to the letter the city sent over is, yes, we anticipate helping the city with their budget deficit.
Is there the $15 million, though, that they requested in your plan?
Well, I tell you what, I believe we have something in front of us next week. I know we do next week relative to the CARES Act distribution. So we will have that in the chart for next week. So we are evaluating the request. I mean, obviously we want to be helpful. And so we'll kind of crack that nut next week.
And one other thing for you, there's something going around on social media about a protest for George Floyd on Monday afternoon at the courthouse. Are you concerned about a large gathering on county property and orders against such large gatherings?
I am unaware of what you're referring to, although I do, and Greg could speak to this, large gatherings with people not standing safely apart from one another or not wearing masks is challenging. I mean, I don't want to we've got the expert in the room, so he's moving towards the podium, but I hate to comment on something I'm not aware of, but I'm going to let Greg also answer the question.
So real high level, anytime you're in groups of people, you do run the risk of spreading an infectious disease among different family members and among those groups. I want to reiterate, though, the governor and director of health have been very clear. The stay-at-home orders do not impact free speech. So while it might not be advised that people come together in groups, it is protected, and so they are welcome to do that. If you are planning to participate, obviously it's really important to consider wearing those face masks and to consider giving yourself space from other protesters so that you can keep yourself safe and those other protesters safe as well.
And then if I could just ask one question of Nick. Oh, sure.
Greg and I were actually talking about this earlier today. So people are tense right now. People are tense. People are out. We're in a new space. People aren't used to it. I think we have to be patient with one another. I do think we should, when we're out, behave in a way that assumes that either we've got COVID-19 or the person next to us has it, right? And then we act in a way that keeps everybody safe. The situation you describe, there are a lot of things going on in this country that are really troubling. Troubling to people in those communities, troubling to people in our own community. People want to respond. They want their voices to be heard. There's a safe way to do that, and I think that's what the health commissioner is saying. We do not want to discourage people from participating in public speech or lending their voice to what's happening. There's a safe way to do it, and so hopefully that's how it transpires. But in no way do we want to say we don't want your voice to be heard. That's not where we sit. That's not what we're trying to convey, and I don't think anybody's saying that. But it's an important time to recognize that people are a little on edge right now. There's a lot going on right now, and we just have to remind ourselves that there's a safe way to do all of the above in this community.
And finally, if I could just ask Nick one question. The commissioner touched on this too, but the idea of stockpiling or keeping some of these materials in stock for what could be a second wave, could you talk just a little bit more specifically about how you're doing that? I mean, you mentioned that the requests are far outstripping the need right now. So how are you managing to stockpile for the future as well?
So what we're doing N95 masks, those are going out the door as fast as the state distributes those to us. But masks that we buy, so what we do is we don't. So somebody may call and say, I need 1,000 of X, 1,000 masks, and we'd say, well, how long is that going to last you? And they'd say a month. Well, how about we give you a week or 2 weeks, and then you give us a call back if you're not able to procure that yourself. So again, we're a backstop in a time when some of these providers can't get them themselves. So we're ordering extra, if you will. We are negotiating with people if they call and ask for X amount of hand sanitizer. Obviously, that is more widely available on the open market now, but not that we won't help a nonprofit or somebody else with some of that. But we'll give them one of our gallon refillable jugs and ask them to use that, or one of our gallon jugs and ask them to use that sparingly. So we're keeping just a little bit back each time. We're still fleshing out that strategy, but I know for a fact that we're meeting anytime we get a legitimate request, which are most of them, 99.9% of them, we are meeting the need that they ask for. It may not be to the extent or as long as they'd like to have it met, but then they can call us back in the next week or two and request other PPE. So that's basically how we're doing it. We're sort of managing how much is going out the door at any given time.
All right, thank you.
Our next question comes from Scott Wortman, and it's for you, Greg.
Good afternoon. Morning. Oh yeah, I guess I got ahead of myself there. I had a few questions on enforcement. Hold on one moment here. First off, have any cases resulted in any complaints against businesses, resulted in any action either by you, the health department, with a cease and desist or referral to the prosecutor or law enforcement?
I know of one facility early on that received a cease and desist order and had made some corrective measures to rectify that issue.
Is that the Silver Spring restaurant?
Yes, that's correct.
Did they address that? I tried to call last week, but they didn't respond. Are they no longer serving on that?
Well, a lot of change has happened over the last 2 weeks, as we know, and including the shift from only outdoor eating to indoor eating as well. So certainly that came in their favor. They can now utilize the interior portion. At the time of the complaint and at the time of the order that we issued, they were utilizing the inside space too early. And we issued that order because it's really important to keep the playing field equal for all of our businesses. If an order exists saying businesses can't use the inside, I want to make sure my team is appropriately applying that to all.
That's the only action that's been taken?
I believe so, although my team manages that, so I'd have to double check to see if there is anything in the last day or two, but I'm personally not aware of any other notices of violation or cease and desist orders.
So when people have concerns over, whether their employer is following the guidelines, and you follow up with them like with a phone call, how do you ensure that they are telling the truth, the employer's telling the truth, and that these guidelines are actually being followed?
So that's a great question. We have a ton of businesses in Hamilton County, and it is our enforcement procedure to start with when we receive a complaint, we contact the business via a phone call. If we receive a second phone call complaining about the business, we do send an inspector out and do a notice of violation. And if they fail to comply, we issue a second notice of violation, and then finally we refer them to the prosecutor's office. That's the process we've lined out. It's very similar to what we've lined out for our nuisance program. We go out, we inspect. If we don't get compliance, we give them an opportunity. We educate our citizens and we educate our businesses, and we do the best we can to try and make sure they understand what is required, make sure they have access to the protective equipment that Nick spoke of that is being required to be worn. And then if we can't gain compliance and we find out the facility is not willing to take those steps, then we take enforcement action. The majority of our businesses, sorry?
I'm sorry, what are you saying, the majority of the businesses?
The majority of our businesses on that initial phone call are often surprised and are learning with us. They didn't know that they fell into the category of being required to wear a face mask. The guidance, it is shifting so much, it's difficult for everyone to stay up and understand what specific requirements there are. And so everyone is continually working to understand these documents. And so by us giving that phone call, we really want to be a partner with our businesses and make sure they do things correctly.
The complaints, now that it's been a week since restaurants could serve indoors, are they increasing, waning, or staying the same? Or
actually, they've stayed fairly consistent, on average about 15 per day. We've continued to see that baseline for complaints, and it's, we actually, it's very different businesses each time. I would say the most common theme that I see come through my email address is somebody driving through a drive-through and looking in the window and saying no employees are wearing masks. And that's really where I come back to this statement of personal responsibility. If you're going through a drive-through and you're upset by them not wearing masks, let's spend our money elsewhere where a business is doing it safely. Take that responsibility, make sure you're safe, and then move on to a new environment.
thank you.
Yep.
All right, I think that is it for questions. Bridget, yes? All right, it for questions. So thanks again to Greg Kesterman and Nick Crosley and our interpreters, of course, and our team. We do have a bit of a team here that makes sure that the production run as smoothly as possible. So thanks, everybody, for being here this morning. Again, a reminder, we're going to go to once a week unless something comes up. We're going to do Wednesdays, and so Wednesdays at 10 will become the new normal time for the press briefings. Thank you all, and have a good weekend.